Too much cholesterol circulating in the blood leads to a slow, steady buildup of plaque along the walls of our arteries. This plaque is the primary driver of cardiovascular disease. To fight this accumulation, doctors prescribe statins to over 40 million individuals in the United States. The clinical data backs up that massive scale. Statins reliably drop the risk of heart attacks, strokes, and death from heart disease by roughly 25%. But despite being a cornerstone of preventative medicine, these drugs face a severe public relations problem. A portion of patients experience statin-associated muscle symptoms, which can range from mild aching to weakness. Even a relatively low incidence of these side effects causes hundreds of thousands of patients to stop taking the medication entirely. Discontinuing the prescription turns a highly manageable risk into a life-and-death gamble. To understand exactly why this intervention is worth the potential side effects, we have to trace exactly how this drug operates inside the human body. The target of the medication isn't actually the heart or the blood vessels. The story starts in the human liver, which serves as the body's primary cholesterol factory. This flowchart maps the liver's cholesterol production pathway. Notice HMG-CoA reductase. This rate-limiting enzyme is the main bottleneck controlling cholesterol synthesis. Statins directly insert into this pathway, blocking the enzyme and completely shutting down internal cholesterol production. Starved of its supply, the liver rapidly synthesizes new LDL receptors across its cells. Acting like biological vacuums, these receptors actively grab atherogenic LDL, the bad cholesterol, and pull it straight out of the bloodstream. This forced scavenging process strips the blood of its excess cholesterol, dropping circulating LDL levels by up to 50%. Shutting down production at the source changes the composition of the patient's blood, clearing the way for the arteries to begin healing. Now we can move out of the liver and look directly at the blood vessels, where plaque has already started to accumulate. With drastically lower cholesterol levels flowing through the plasma, the arteries stop narrowing and hardening. The raw material for new plaque is simply gone. But a slow narrowing isn't actually what causes most fatal blood clots. Clots usually form when an inflamed, unstable section of plaque suddenly ruptures. Here we see a secondary, cascading benefit of the drug, known as a pleiotropic effect. Statins actively alter the physical structure of the existing buildup, hardening it and forcing a thick, protective fibrous cap to form over the unstable tissue. By sealing off the plaque and preventing a sudden rupture, the drug directly neutralizes the triggers for massive clots, heart attacks, and strokes. Research indicates this cellular stabilization extends even to the brain's internal recovery systems. By inhibiting HMG-CoA reductase within the brain's own vessels, statins help trigger neurogenesis and angiogenesis, the growth of new neurons and blood vessels, to repair damage following a stroke. This dual mechanism, strengthening plaque while promoting new tissue growth, armors vessel walls against sudden catastrophic failure. These biological realities have established a global medical consensus. When it comes to LDL cholesterol, lower is better. This bar chart demonstrates exactly why the guidelines are so aggressive. For every 1 millimole per liter reduction in LDL cholesterol, there is an exact corresponding 23% decrease in major vascular events. The fears patients have about side effects are grounded in reality. Muscle symptoms happen, and in extremely rare cases, a severe muscle breakdown called rhabdomyolysis can occur. Yet, extensive reviews by the American Heart Association confirmed that true intolerance rates are remarkably low, and the overall safety profile of the drug is excellent. The data proving its safety is so robust that regulatory bodies recently overturned decades-old bans against prescribing statins during pregnancy. Statins are active biological shields. They force the body to clean its own blood and armor its own arteries, making them one of modern medicine's most precise tools for extending human life.